You're listening to Planet Vero Radio. I am Cindy Schwartz. This is the Patient Partner Show. We are broadcast on iHeartMedia and also podcast on Spreaker. My co-host Jeannie Roller is on Skype with me today. She is in Indiana. Today we're talking about trauma-informed consent. Jeannie, you have a lot of information about that.
I do. Well, last week we finished up talking about two examples of people at different areas, different times. Well, I want to introduce this week with my husband, who is a sexual assault survivor of medical setting. He was in a situation with an MA who told him to strip to his waist for a 3-lead EKG. And, first of all, no one needs to strip for an EKG, and no one should be told to strip. And the medical person should never stay in the room as you're undressing. So he was just flabbergasted. He froze into place. And about the time that he froze into place and she realized he wasn't moving, she started to unbutton his shirt, which really, startled him. And I yelled at her to stop. And I asked her, what did she think she was doing? And she said she was going to undress him. I said, do you not know that he has notations in his file? She said she looked and there was no notations. Well, they were supposed to be in his file. I asked her, I said, do you know what trauma-informed care is? No, she did not. I said, well, every medical person should know what it is. Now, I don't believe she meant to harm my husband, but because of her ignorance and because the medical practice didn't keep their word in adding this to his file, they further traumatized him and have more mistrust. For many of us, medical exams are invasive in nature, whether you are getting a physical exam or a mental exam, because a mental exam can ask sensitive questions that you aren't really prepared to share with other people, the answers. Physical exams, of course, examine intimate parts of your body that you do not show to other people unless it's your husband or wife or someone that you decide to show your body to. And most of the time, medical treatment is delivered to us by absolute strangers that we are told to blindly trust, which presents a huge issue for people who have especially been sexually assaulted in the past.
Right, yeah.
So trauma-informed care improves how healthcare providers interact with patients by espousing practices that promote a culture of safety, patient empowerment, and healing. And for a person who's had a terrifying life experience, such as sexual assault, any medical encounter can bring back prior suffered trauma, because the medical encounters, the bounce of power is so stark that it makes those people feel helpless all over again.
Right, absolutely, yeah. So how does someone get that trauma-informed paperwork?
Well, it's not really paperwork. Medical providers should be taught this in school. There are basically what I call the 4 R's. There are other versions of trauma-informed consent that may use 5 different principles or 6, but I'm going to do the 4. They need to realize widespread impact of trauma and understand potential paths for recovery, meaning that they should know that every person that they come in contact could be a victim of some sort of trauma, whether it be sexual or maybe criminal. Maybe you were a victim of a violent crime. They need to recognize that, and they need to be able to see the signs and symptoms of patients, because like last week, the older woman I talked about clutched the cover to her chest and wouldn't let them move it. That is a sign. If that medical provider had been trained, she should have recognized that. Sometimes people get really quiet during a medical exam or nervous. Responds. They need to put all the knowledge of the trauma into policy and procedures and practices to help the patient be able to endure a medical encounter. And I say endure because it is very hard for someone who has been traumatized to give any amount of power to anyone else. And they need to actively resist re-traumatizing patients. So, some important principles for trauma-informed care is promoting helpfulness, honesty, and trust in relationships between staff and administrators, and most importantly, between the medical provider and the patient. Everyone needs to work together to guarantee the best atmosphere for every patient. They need to provide a safe, secure, and calm environment for all involved. And an example of this would be a lot of times when women are going in for their annual exam, someone will just open the door and walk in while you're there with your feet in the stirrups. That should not be happening. No one should enter a room without knocking and first asking permission from whoever is in that room. The other thing is everyone's voice, the patient's voice especially, needs to be heard.
Well, that's what I was going to interject. So what is the patient, we have like 3 minutes left. What is the patient responsibility for this? A, and I had someone tell me recently that when you go into these different intimate procedures and whatever, you just kind of grin and bear it, and it's just the way it is. And so from what I'm hearing from you is, no, that's not right. It isn't grin and bear it. It should be definitely respect, and it should be told, the stuff should be told up front, because like we said on many other podcasts, this doesn't happen in every facility. It doesn't happen in every doctor's office. So why is it happening in some offices, some facilities, with them telling us, the patients, this is just the way it is, basically suck up, and that's how it is, which we know that that's not true because it doesn't happen that way everywhere.
Well, and the next thing I was going to say addresses that they need to recognize and understand that not everyone shares their culture or their belief system.
Okay.
So that's why it's important to have the trauma-informed care protocols. And they need to understand how prior trauma can impact future care. And they have to assume that every patient has had trauma somewhere in their life and give every patient trauma-informed consent care. And that means don't touch a patient without prior permission. You need to explain why you feel something needs to happen and ask explicit permission. Just don't believe because the patient is there that is permission to do whatever.
Mm-hmm. And you and I have talked about this, where they just inundate the patient with drugs, and therefore that's the get out of free jail card for them, because then you're not aware of anything. You're just a mute, and I don't mean any disrespect, but a mute blob on the table, and therefore you're submissive. So a lot of it has gotten to that, which I don't understand the dynamics of that, because that's complete lack of patient and humanity respect, first of all. And second of all, legally, that's not right. I mean, it just isn't right. Do you have to bring the lawyers into all of this? It's crazy.
Well, right. And it's when there is an exam happening and they should be able to see that a patient is upset, they need to stop and they need to ask, can we continue? Are you okay? That is the kind of thing that trauma-informed care teaches them, to be receptive to what the patient is saying, and mostly what they're not saying.
Mm-hmm, mm-hmm. And you know what? We are aware of that. In the first thing that comes to mind is the dentist chair, because it's kind of funny in one way. Your mouth is full of all kinds of cotton and blah 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 blah, and the dentist will continue ask you, "Are you doing okay?" or raise your hand if you're not doing okay. And it also reminds me of the veterinary's office, where they take extreme care with the animals because they might get bit. I mean, it's just the form of nature is how it is. So how are we as human beings not given that same courtesy in a medical setting? I want to give information, Jeannie, for the listeners to get in contact with us at patientrights.com. You can email us at info@patientrights.com, patientrightsinfo.com. I'm sorry. Let me say that again. It's patientrightsinfo.com is the website. And also kudos to Misty Roberts, who's a patient partner of ours. She's in Medical Patient Modesty on Facebook, and also patientmodesty.org. So some good information again on this podcast. Please stay tuned and listen to Planet Vero Radio.